Good afternoon. I hope that movie helped to extra energize you after a long day, and also gave you an idea of some of the importance of data, which I'm going to talk about today. So, my name is Mike Starkey. I'm the CTO for IBM for Central and Eastern Europe. And if you're trying to guess which Central and Eastern Europe country I come from based on my accent, I'm actually from Canada, but I'm working in Prague. I've been there for the last 3 years. So what I'm going to talk to you about today is measuring the world from gold mining to data mining. Oops, if we can go to the next chart. I forgot my clicker. I think I might have put it on the chair. So if you can just go to the next chart. You got it? I can't see it. Oh, that's where I put it. Okay, my fault. All right, so yeah, no, it's my fault. So, all right, so let's talk a little bit, about the metaphor of. Hello. All right, so I want to talk a little bit about the metaphor of gold mining versus data mining. And if you think about it, how we find gold, we can find nuggets in the middle of other rocks when panning for gold. Also, we find gold in ore, but in both of those cases, we need to extract the value out of the gold, separate the fool's gold or whatever else is around it, and really understand and get the value out of it. Just like with gold, that helps bring value, helps us make important decisions, and also helps us compete. So you've probably seen charts like this where you see sort of the growth of data that we expect, and data from many different sources. There's obviously enterprise data. That's the kind of data from the orders we make, entering our address information, creating bank accounts, that kind of thing. Voice over IP, social media, and of course sensors from Internet of Things. But one of the things about this data is a lot of it is what we call uncertain. In fact, about 80% of it is uncertain. So certainly when you enter your address, probably that data is valid and it was accurate as you typed it in. But when we get data in social media, for example, people have written it. It's not necessarily completely accurate. It may be hard to understand what's in that text or in that tweet. If you look at some of the data we get from sensors, so even pictures that might be fuzzy or data that's inaccurate from an analog sensor, we can't necessarily rely on all the data that we get and the sources that it comes from. So one of the things I'm going to take you through is what we need to do to actually get to take that uncertain data and be able to use it to change how we do business in certain industries. So there's some common examples. So for example, in healthcare, we can use data and information to help diagnose patients. For banking, obviously, we can detect anti-fraud with some of the big data work that we have. Oil and gas, we can look for new reserves based on large amounts of data. And then in retail, we can start to understand buying patterns. But let me take you through maybe some areas where big data is really starting to change the business and disrupt the business. So for example, epidemiology, so looking at outbreaks of diseases. So one of the things that we can do is we can look at social media, and people might be tweeting that they don't feel well, they have a headache, they have certain symptoms. And so by looking at that and analyzing it, instead of doing epidemiology through clinical information of people going to doctors, we can actually do it based on some of the social media information that they have. So it's a very powerful way to actually look at some of the epidemics and even seeing how they might migrate over time. Also, insurance. So by looking at natural disasters or weather, you can come up with different risk profiles for different situations. So if somebody has a house in a high-risk area and wants to buy insurance versus somebody who has a low-risk, is in a low-risk area, why should their policies be the same? Presumably the person has lives in a more high-risk area should pay a higher premium because there's a higher potential of payout for that customer. In addition, insurance companies can actually predict what might happen. So if they see that there's a hurricane that's going to hit a certain area, they can start to plan because they know that they'll probably have payouts or require payouts because some of those houses will be hit by the hurricane. So that changes the whole insurance industry in terms of being sort of passive and coming up with premiums not based on information to be more active, and also being able to prepare for some of the things, the events that might cause them to have to adjust their business. And thirdly, if we look at, or another example is if we look at African banks where people don't necessarily have credit references or credit ratings, we can start to look at some of the patterns of typical customers and then start to make decisions about how much to loan them, what the terms need to be, and what the risk is of somebody paying it back. So again, that's something that changes the way that we do banking in some of these emerging countries to allow still things like loans, but in an environment where they might be riskier than where we actually know more information. And the one area that we really see a huge change is in healthcare, and a lot of it is because there's a lot more data now being generated. So certainly we have the clinical data for people going to the hospital, going to the doctor. We have genomics data, DNA mapping, and so on. But then we have all this data from Apple Watches, from Fitbits, all of that kind of information that's also key in terms of understanding our health. So for example, we can start to understand a lot about lifestyle choices based on all of this information that's being created around us. So we see there's going to be a huge amount of information available for healthcare. So let me talk a little bit about what we mean by uncertain data, just to sort of give you an idea about that. I gave you some examples, but actually there's some things that because we start to look at some of the text and we use that as data, there's certain things that's helpful to understand about how we express things and how a computer might understand that. So certainly if you have structured data, you could easily ask for where Einstein's birthplace is and return back Ulm. But if you take the second statement, so one day from among his city views of Ulm, Otto chose a watercolor to send Albert Einstein as a remembrance of Einstein's birthplace. It's not exactly clear that Einstein's birthplace is Ulm. There's some interpretation that needs to be done with that text to be able to answer the question of where was Einstein born. Second example, so if leadership is an art, then surely Jack Welch has proved himself a master painter during his tenure at GE. Again, we can read that as humans, we can understand it, and we understand that means that Jack Welch led GE, but it's not clear just from the text that's written there. So one of the things that we started looking at is how we can actually have cognitive systems that help interpret data the way that humans would interpret it, and then be able to use that data for more and more different kinds of applications. And when we talk about cognitive, we're talking about systems that are adaptive. They can learn over time, that are interactive because they need to interact with the person. It's not just about asking a question, but it's also about then refining that information to get to what the real answer is. Also, natural language processing we feel is very important because the people interacting with the systems don't necessarily want to talk in computer speak. We want to enable doctors, accountants, bankers to be able to use these systems and to interact with them in a normal way. Plus, a lot of the data that's being used is also written data that requires natural language processing, like those two examples that I showed you earlier. It needs to be iterative and stateful, so it needs to actually iterate to get to an answer, and then also remember what answers were provided before so that it can use that in the future. It needs to take the context into account, so if the question's being asked in one country versus another, the context might be important in terms of understanding what the question is that's being asked to the system and then answered. Needs to have some level of reasoning, so some way to actually not just give a explicit answer, but to come back with potential options, and then once an option is chosen, be able to go back and forth and iterate on that. It needs to use some machine learning to incorporate the corpus of information, and then learn over time as different answers are taken and different information is added. It needs to be fast, otherwise it's not really important if you can't get that cognition quickly. And it really needs big data. It needs a lot of data, just like we have in our heads. If you think of a cognitive system as sort of doing some of the similar tasks that we do, we have a lot of information in our heads that we use to interpret information. And so we actually see that this is a new era. So we had the tabulating era where we had physical machines to do census counting, to do weaving, a lot of different tabulating kinds of machines. Then we got into the programming era, where we could program systems to do many interesting things, including some of the analytics around big data. But what we're seeing now is actually really a new era around cognitive systems, where you feed the system information, it learns and grows, and that information is actually then what's important to the system. So we think that this is a new era that we're entering now to actually make machines that can perform tasks similar to humans. So just to give you an example of that, so an example would be a doctor, let's say. So let's say you go into the doctor and you have a cough. So the doctor can say to the cognitive system, my patient has a cough. And the system could come back and say, well, do they have a fever? Have they traveled to an area that has infections? And a number of different reasons. And so then the doctor can ask the patient, and the patient might say, well, I don't have a fever, but actually I have an allergy. And so they feed that back into the system. And then it comes back, and there may be further questions. And then eventually it'll come up with an answer. Then there's a 90% chance that they have an infection, a 70% chance that because they were traveling in this area, they've picked up a virus, whatever the percentage is. And then that can be further refined. So the doctor might say, well, it's not this one, I think it's this one, and then you can go down into further detail. And through that whole process, the information that's being used is a lot of the literature in that area. So, for example, for the doctor, it might be the American Medical Journal, it might be other journals that incorporate that information and is used as the intelligence to actually make these kinds of decisions and give this sort of advice. Now, the important thing is this isn't Terminator. This isn't computers taking over the world like people. It's really as an advisor to professionals. So the reason why I talked about the doctor and the doctor interacting and giving the patient's information, and then the doctor getting the answer, and the doctor giving the prescription to the patient, is it's not about removing the doctor. It's really allowing the doctor to do their job better. And if you think about it, the usual general practitioner has to handle a lot of different symptoms that people might have. It's very difficult for them to keep up with the latest information in the latest medical journals, and even the historical information for that matter. And so by having an assistant that has all of that information and can aid them, they can do a much better job at what they're doing. So this sort of leads us to new architectures where, for example, we need to take the question, we need to analyze the natural language around that. So we actually have to decompose the question and try and understand the question, see what some of the potential answers would be, see what the evidence is then that backs up some of those answers to see if they're valid answers to actually reply to the professional. And then when they select one or two of those, to then feed that back into the system. So we see a whole different architecture in terms of how we do the question understanding, and interpret the data that's there, do the matching, give some level of confidence of the answers that are given, take that input, and then iterate around until we can give an answer with some confidence level back to the doctor or the professional. Now, if you think about what we're trying to do here and sort of replicate the level of human cognition, we've tried, so in the industry we've actually tried cognition at different levels with different complexities, sort of simulating neurons and synapses in the brain. So around 2007 we could kind of get to the level of a mouse brain. 2008 a rat. 2010, some simple kinds of human scale simulations, and at some point maybe we'll get to real human scale, but it's really unknown when we'll get there. Now, one of the things that our research division has been working on is actually how we can do this in hardware, because we believe that to get that kind of scale, it will be difficult to do it in software and with standard processors. So we've been looking at how we can do this in hardware, instead of looking at how we model the brain on a von Neumann architecture, actually how we take the brain and create an architecture around that in silicon, or in hardware, I should say, not necessarily silicon. And so this is a project we have that's looking at that. And we've got to the point where we can actually create a chip that has 16 million neurons and 4 billion synapses. So, this isn't production ready, but this is just to give you an indication of the importance that we see of this direction and some of the additional research work we're doing in that direction for the future. So let's go back to how you can use this stuff today. This is sort of future things, but we do have our cognitive solutions, and we've called Watson, that you can actually use today. And the way that we do that is something called through a platform that we call Bluemix. And actually, if you go to the booth just out here, you can see some of the Bluemix in action. You can see some of the applications they developed, as well as the interface and the platform that we're using. Bluemix is an open platform. It's based on SourceForge. We've added a few things like editors and different services for people to write more powerful applications. And some of the applications, or some of the services that we've written, are actually Watson services that use some of the cognitive computing that I've been telling you about. So just to tell you a little bit about the platform and why it's valuable for creating applications around Watson, it allows people to create an app or an application and then quickly deploy it into the cloud to utilize some of the services in Watson. So it's a very good way to exploit Watson services to create applications that then use that cognitive expertise to add value to the solutions people are building. So just to go back, so what this allows you to do is incorporate some of the aspects of perception, reasoning, relating things together, and being able to learn into the applications that you're building through the Bluemix platform. And I'm going to take you now through some of the examples of the services that we have, just to give you an idea. It's a subset, so there's more of them, and there's more coming all the time, but it'll give you an idea of some of the power that cognitive computing can bring to some of the solutions that you're building. So one of them that we have is actually to use analysis to determine the personality traits of a user. So people do analysis of tweets and Facebook information and so on to find out what people like and don't like. What we actually do is we look at the content of those tweets and determine whether the person is very open, whether they're conscientious, whether they're an extrovert or an introvert, whether they're agreeable, whether they worry a lot. And we can actually determine that by doing the natural language understanding of the content in some of the social media posts that they make. So, we haven't necessarily, there's interesting ways that you could use this, and this is available in Bluemix today, where you can actually put in some user information and then get an analysis, and we typically have a very nice visualization of that to understand the traits of a person based on their social media interactions. The second one we have is something that can take text and actually figure out the relations in it. So again, this isn't an application in its own right. You could use it as part of another solution. But for example, we can decompose the paragraph here and sort of say, DHL is a logistics company. There's references to it that we understand as DHL in this context and a company. So that just gives you an idea of some of the ways that we can decompose the text and sort of get those kinds of relationships. Now, as you can imagine, this is very language specific. So we've done it today for English and Spanish. We don't have Lithuanian, but we are adding Japanese. And a lot of this really takes a lot of coding and learning into the cognitive system to understand how people write things in certain languages to be able to interpret them and provide these kinds of relationships. So that's just an indication of some of the services we have are based on only support certain languages, but just because of that natural language processing that we need to do. So we also have a question and answer around travel. I think this is mainly around what shots you need and what outbreaks there might be, because we have mainly the CDC and the TSA.gov information. And so you can ask questions, what shots do I need to go to Lithuania? It might come back and say, are you going to be in Vilnius, or are you going to be out in the countryside? So, some of those questions, and then might say, well, then you should get a tetanus shot or something like that. So it provides that sort of Q&A to provide an answer around travel. And we have one for healthcare. So you can ask questions in healthcare if you use the service in Bluemix to, again, say, I have a cough, and see what it comes back with, and then iterate on that to see what the answer would be based on the information that we've incorporated into that service. So that's just an example of some of the things you can do today. There are many other ones, but I just picked what I thought would be an interesting subset to show you. So to sort of, sum this up with a solution that that might be more understandable or simpler. One of the things that we've done is we created something called Chef Watson, and we've actually had Chef Watson. We had it in Austin, Texas. We had it in Brussels, Warsaw, and there's a restaurant in Riga that's actually using Chef Watson as well. And what we did here is we actually fed all of the recipes from a restaurant from some famous chefs into Chef Watson. And it formed certain relationships between ingredients, because it could see that these ingredients were used together. And then what we did is we asked Watson for a recipe, say, for fish, and it would come back with something based on some of the relationships that were built through the recipes. So I was actually at an IBM facility about 3 weeks ago, and they were serving all dishes from Watson that had been created through by Watson's understanding of recipes. And the recipes look really strange. Some of the ingredients, some of the names, but actually they tasted really good. And so it was interesting to see that Watson could actually understand some of the patterns in these recipes that maybe some of the chefs couldn't see, and could then actually return those back. And they were actually very, very good and interesting combinations. And just to give you a sample, which is one that, when you look at it, I think you're going to be surprised, is there's actually a recipe for strawberry curry. Now, those aren't two flavors that you would really think would go together. Banana curry maybe, but not strawberry curry. But this is one that was actually created by Chef Watson, and is based on other recipes that had relationships between these ingredients. But then it returned this insight of some of the patterns it had seen to say that this would be a tasty recipe based on some of the ingredient combinations. So, just sort of a simple example, but one where you can see that based on a large amount of data like recipes, there's patterns that we may not see, but then actually create valuable information. And this is in a simple example. So I just want to show you a humorous video about Watson, and maybe if we could show that now, please.
Bob Dylan, to improve my language skills, I've read all your lyrics.
You've read all of my lyrics.
I can read 800 million pages per second.
That's fast.
My analysis shows your major themes are that time passes and love fades.
Well, that sounds about right.
I have never known love.
Maybe we should write a song together.
I can sing.
You can sing?
Doobie-bop, bebop-a-doo. Doobie-doobie-doo. Do, doobie-doo.
All right, so thank you. That's what I wanted to present today about data mining and our cognitive computing, the importance of it, and I hope that I've stimulated some of your interest. We don't really have, unfortunately, time for questions, but there's a lot of information on the web, or you can contact IBMers if we can help you with any of your questions. So, okay, thank you very much.